Hi, everyone. Thank you so much for joining us for today's episode of Autoimmune Health. And today I have the privilege of speaking to my personal friend, someone who I really admire in the field of mental health. Her name is Carisa Oyebanjo. She is a licensed therapist. She's also the president of HMS Therapy Services, which is based in College Park, Maryland. So, Carisa, thank you so much for joining me today. I really, really appreciate it and taking the time to do this.
Emily, thank you so much for prioritizing this very important topic right now. And I really support all of the work that you do in wellness and health. And so I'm very honored to be here today. Thank you.
Thank you. Well, you alluded to it, our world, our city, our communities are seeing a lot of changes happening right now due to this virus called the coronavirus. The World Health Organization has recently declared that this is a pandemic. So a lot of people cities are putting restrictions on traveling and, large gatherings and things like that. But also this is really causing a lot of disruption for a lot of people, their normal way of living. Kids are not going to school. Adults are having to stay home and kind of restrict their going out and everything like that. So I just really wanted to talk to you about what are some sort of best practices and things that we should be thinking about as we are sort of trying to navigate through this very challenging time. So thank you so much again for, just your willingness to do this. So I'll jump right in, but I do want to know, like, as a therapist, how did you sort of react to all of this going on and having to make all of these changes in your life? Like, what was your initial reaction?
Absolutely. That's such a great question. And I have to say, as a therapist, my initial reaction was anxiety, right? Hey, like when I heard it, you start thinking about, what's going to happen with the kids, and especially when really the anxiety didn't hit until the schools were shut down for 2 weeks. And then I'm kind of good at reading body language. And so looking at the officials and watching how serious their tone is, I just said, I have to take this very seriously. And so that initial reaction was mild anxiety. And then I went into kind of planning and preparing and figuring out what will we need and how can I move forward with that. That was very helpful.
Yeah, it's actually encouraging to hear you as a licensed therapist feel a little bit of anxiety. Kind of makes us feel like we're not alone, like everyone is doing the same thing.
Definitely. Absolutely.
Yeah. So obviously there is a lot of anxiety happening right now.
Yes.
How do you suggest we process this? What's the best way to process that anxiety to sort of, I know we're going to feel it, but what do we do with it once we feel that anxiety come up for us?
Absolutely. That's another great question. And first of all, I want to say that it's normal to feel anxiety when it comes to something like when a sudden and health issue or crisis, really, such as the coronavirus pandemic occurs. It's normal to have a mild level of anxiety. So I want to just normalize that and validate people's feelings about that. Where we get into trouble is when it's excessive fear and panic that happens. And so what we want to do is allow ourselves to feel like it's okay to feel a little anxious and let that anxiety propel us to doing what we need to do to prepare for such a thing. And so, for instance, if we had no anxiety and we were completely nonchalant, we probably wouldn't have gone and bought some groceries and preparing our home and practicing the social distancing that's recommended. And I think that's great that you're doing that, Emily, on this podcast today with doing it via video conferencing. So I just think that those are some of the things that you can do. Allow yourself to recognize that some anxiety is okay, to really guard against serious anxiety and excessive anxiety by limiting the amount of time that you're taking in news about the coronavirus. So, for instance, don't have CNN or your local news channel on 24 hours a day while you're working. Make sure that you say, maybe your limits will be that I'll watch it in the morning in the morning and then maybe in the evening and kind of catch up and see what's happening.
I like that advice, like restricting your consumption of everything coronavirus, right?
Yes.
It's okay to do that.
It is definitely okay. Now, the other thing is, though, another way of dealing with anxiety is having information. And so you need to do your research, right? Like for me, that helps a lot too, to have research. What are the symptoms? Looking at the websites, the CDC, and kind of being aware of what you should be doing. And then you tell yourself, okay, now I have my plan, so I can kind of be calm in dealing with this.
Yeah. And I guess it's important to also note, like, be careful where you get your information from, right? Because if you're on
Absolutely.
social media a lot, you may not be getting the most accurate information, let's say.
Yeah.
So be mindful of that as well, would you say?
I would definitely agree with that. Like I tend to look at Dr. Anthony Fauci. He's, one of the probably the premier person right now. And I'm looking at some of, in terms of social media, some of the doctors that I know or I'm friends with. Like I trust their information output, and so I agree with you on that. Just being careful.
Yeah, and thanks for that recommendation too.
Mhm.
So yeah, you did touch on stress, and we know, like you said, stress and anxiety is a normal part of, having to deal with something sudden like this. But we know that too much negative stress is not good for our bodies. It can actually, shut down our immune system, and we won't be able to fight off any, virus or whatever that may come our way. So we need to be really careful about the stress that we allow to kind of permeate in our lives. But in terms of that, how do you suggest we handle that aspect of it? Because we realize that stress can become an issue if we don't sort of, get a handle on it. But what would you suggest in
Yes.
that regard?
Okay, absolutely. Well, definitely because this pandemic is affecting so many areas of our lives, both our businesses and
Mhm.
churches and schools, we have to recognize that stress will increase during this time. And so we have to be very proactive and have a stress management plan.
Mhm.
What am I going to do to help to decrease my stress? And I would make sure that you have a list of 5 things at least that you can do to decrease your stress. And I'll give you some ideas. One of the things that we could do right now is to make sure that all of our conversations are not dominated by the coronavirus.
Mm.
We're going to do a quick check-in with each other. We're going to talk, but then make sure that you're talking about pleasant things too. Make sure you're talking about your goals and your dreams, your aspirations. So that's one thing. So don't dominate all conversations with the coronavirus. Make sure that we're meditating, even if it's 1 minute, 5 minutes, 10 minutes, 30 minutes. Prayer, reading scriptures can be helpful, being in touch with your spiritual self, making sure that for those of us that have decided to work from home, that we're exercising, that you get outside, take a walk, soak in nature, right? I think
Mhm.
important as well. And then another thing to manage stress is to really monitor your negative self-talk. Like, what are you saying to yourself, whether it's about the coronavirus or anything else, and really trying to challenge any negative thoughts or anxiety producing thoughts with positive, calming self-talk. Because
Mm.
a lot of stress has to do with how we react to what we're thinking about the stressor, right? So
Yeah.
in my practice, I talk to a lot of people, and some people are like, oh yeah, I'm being mindful and watchful, but it's not really stress causing me too much stress. And then others, it's causing a significant amount of stress. So we target how are you thinking about it, and and shifting that a little bit.
Could you give an example of that? Like, let's say, I don't know, what would be what would be a good example of what's a common thought that may come up for people, and then how would we redirect that thought to something more positive?
Absolutely. So, for instance, when you're watching the news or something, and you're hearing about the coronavirus, one of the things, this may sound morbid, but people are thinking it like, what if I die?
Mhm.
What if
Yeah.
this happens to me or my mother, my grandmother, my neighbor?
Mhm.
One of the things that I would encourage you to do is just to challenge that thought. As soon as you recognize that you're having it,
Mhm.
something like, we are informed, we're practicing preventative strategies, I have a plan, and I'm not going to focus on things that I can't control, right? Anxiety will not dictate my life. And so
Mm.
just challenging and refuting those statements can really help to create a sense of calm. Because these times, sometimes we want these anxious thoughts to take precedence over our mind,
Mhm.
more control over them than we think that we do.
I love that, Carissa. That's amazing. And you had touched on work situations. People are going from working in an office full time to working remotely for, however extended period of time we're looking at here.
Absolutely.
So, that's a sudden shift for a lot of people. They're not used to working from home. And then there comes with that some challenges as well, time management, having to deal with kids
Yes.
and be working at the same time.
Right.
But in terms of like transitions such as that, what is a tip that you can give someone in making that transition and making it not so disruptive to their normal work life?
Absolutely. And Emily, this one touches me personally because I made the difficult decision to just practice telehealth through the next 2 weeks. And I have to say that that decision was a very stressful decision for me because I didn't want to pique my clients' anxiety by closing the office, and how would that look, and am I going to meet people's needs? And so definitely one of the things that I can say that you can do in this transition is to prepare. We know, probably most people know people who work from home full time, right? Like they've been doing it for years. So ask them, how do you do it? What do you do that helps you to keep things sane? How do you structure your day? You take care of the kids during that time. And so I would definitely recommend that we talk to other people. And then one of the other things that you should do is come up with a good schedule for yourself and your family. If you have kids or a husband, a routine. For some reason, routines tend to calm us as humans. Routines, we know what we're doing and how we're doing it. It provides a sense of calm. So come up with a great healthy routine, and then set hard boundaries around your start and stop times at work. You want to make sure, okay, I'm starting at 9 and I'm ending at 5. Those are just theoretical times. It could be whatever time you need, but I'm not going to work all day because I'm in the house all day. I think that's something that's important too.
Yeah, that's a great point. And it's interesting also to hear conversations or see things on social media, because I see also there is this sort of the silver lining to all of this. I see people kind of looking at this as an opportunity to pull back the reins in some areas of their life, refocus their priorities and things like that. But what would you say are some of the ways that we can take advantage of this time even?
Absolutely. And I think one of the things that we can do is really sit with ourselves and say, what are little projects or big projects that we've been wanting to do kind of around the home, or personal projects that time is going to give us the opportunity to focus on, right? So that's one of the things we would do. Like I can think of a few closets in my house that would be very, very therapeutic for me. I can think of, for my daughter, some art projects that she would do. I've always been prompting her to read a book, and not a book, she reads a lot. Write a book is what I wanted her to do. And so I think, just thinking about what are some personal projects, learning a language, things like that, that might be helpful for them. And then what I really want to urge people to do is to embrace the slower pace. And embrace the slower pace that's being enforced upon us. We like to have a slower pace when we have control over it. Like we want to schedule our vacation, we want to take a day off, and then that's our slower pace. But when it's imposed on us, we feel stressed. But I would encourage you to embrace it. We have been running at a sprinter's pace for so long that we need to embrace this marathon pace that's coming. Because guess what? That sprinter pace will be back. It may not feel like it right now, but it's coming back. So to try to embrace that time, take some me time, rest. I would encourage everyone to rest. That's a protective factor, which you could speak so much more on in terms of health, but protective factor for us when we rest our minds and our body, and just
absolutely
have that time.
Absolutely. And I love it. And you know me, I'm an introvert, so I'm actually okay with not having to go out as much. And you're right, though. This is a great opportunity to do that, to just take that rest that is so needed for everyone, I think. And so thank you so much for taking the time to talk to me and share that with this audience that we're going to share this with. So I really appreciate it. So one last question, how can people get in contact with you and find out more information about the work that you're doing?
Absolutely. I have a private practice in College Park, Maryland. It's entitled HMS Therapy Services, which you talked about earlier, where I treat adults for counseling. And you can find me on my website, which is www.hmstherapy.com. And then I also am a co-founder of a wonderful nonprofit, the Renew and Revitalize Marriage and Family Institute.
Woo! Love that.
Yes, thank you. We serve families and children, and we have an annual conference that we do, the Renew and Revitalize Marriage Conference. And so if you would like more information about that, people can find me at www.revitalize.org.
Perfect. Thank you again, Carisa. I really appreciate your time. I hope you have a great rest of your day and make the most of this time as well.
Thank you so much. Enjoy the rest of your day too. And I really feel privileged in being here. Thanks again.